So hello and warm welcome to everyone. Today is the ninth club meeting for IC Innovators Club. This is the ninth virtual meeting, and today the topic is about future of healthcare in the next 20 years. It's a very difficult topic, and nobody is able to predict the future in one way or another. But yes, we do try to make some attempts in understanding what's happening, what's coming. And as a student for future studies, I always enjoyed being part of such conversations. So it's a proud privilege for me to be part of this program today. And we would like to start the program by inviting Dr. VK Singh, who is the managing director for InnovatioCuris Private Limited. So sir, good evening to you, and warm welcome. So maybe you can say a few words about the program today to start with.
Good evening, Sachin, and all other speakers and the listeners. It has been my privilege to be here on the screen. It's really the kingpin of the today's session will be Sachin. He is a technology person. I am from the medical side, and I find that Dr. Neha is also from the medical side and few others. So I'll give a very different perspective. Is one that when you are talking, there's no doubt technology will really take over the health sciences, medical sciences, and there are many people who are joining, medical doctors who are joining the computers as a better paid job as probably one reason, or it is a new fad which is there, but everything which has a good also has a bad. I remember my medical student days when the diagnostic only had an ECG machine and X-ray. We did not have ultrasound, CT scan, MRI. Now younger doctor will be thinking which era I'm talking about. So that is something which we have, our teachers and professors always thought that clinical acumen is the one which you should think of. Now, highest person, the consultant, he does not put the patient, hand on the patient. He doesn't take much history. He immediately write MRI, CT, blood report, etc., and diagnose the person. Is it good or bad? As I always mention, Khosla, the billionaire, always said, and I had a tiff with him, he's US based, that I don't need doctors, my computer can do everything. Will you like to be treated by computer? It should aid you or something. What has happened is right from this industrial revolution, go up to the digital revolution, and that lots of things have happened. So our all technology must be taken as assisting us, the medical people. If you really say simple thermometer, it was mercury based, then come digital based, and now it has come infra based, that from distance within few seconds it can take your temperature. This is what more used in COVID. So there are various parts of the things which are there, and the technology, like Sachin have been talking a little while ago, and he is a profound reader for artificial intelligence. Is the cancer, radiology, etc. Yes, but they cannot, they can only lighten your work. They can also confirm your thinking. Even the prescription in the US need to be confirmed by the digital method, and then you can put your head if there is something wrong, or otherwise it alerts you. It's really good. But it cannot. Robots have come, teleconsultations have come, patient monitoring system has come. Disadvantage, the expert is the Sachin, who is in cyber fellow. There are lots of traffic which will go on that will also have a problem on the cyber side. As I give example, and often the vice president of the US had a pacemaker and Al-Qaeda wanted to disable it. And thank God, his secret services came to know and he was saved. Otherwise, he would have been dropped dead. So doctors don't know that it can also be hacked and the person can be put on to disadvantage. Similarly, let's take all the technology that the human ingenuity, human brain, and human touch cannot be replaced by the technology. Technology should assist, and the way things are, gradually, there's no doubt, technology has already taken over to the extent that you would find that we will be handicapped as a medical people. One way that they are even already talking, do we really will be there in the market at all, or it will be something these technology people will take. I just wanted to thank the Sachin and other people who have put up this the topic for discussion, and all the speakers who will have different point of view. And I would also like to mention that we are bringing a special issue of the magazine on the devices, and that will be in January issue. To start writing something on different devices. Whatever you have is a special edition. Some people may like to put up an ad, advertorials, etc. And we have lots of knowledge platform. The knowledge platform where we have a knowledge platform where we have all these activities. Do suggest us, give us a feedback so that we can make a better for the community and the medical fraternity. Thank you very much, Sachin, and best of luck. I'll still be listening for some time. Just before this, Academy of Hospital Administration, which I was the president and founder, is the one Professor Venkata was talking about same thing, technology, innovations into the healthcare. Thank you. Thank you.
Yeah, thank you, sir. You have always been continuously reminding us about the tension between the clinician and the technology. But I guess we're going to more go in the positive side of the discussion. And I think we have exchanged notes on this topic when I probably shared this book by Dr. Eric Topol, which is called Deep Medicine. And the whole thesis of this book is that the job of technology is to free up doctors' time, which sadly, which is not the case today, and they have to spend more time on the screen than looking at the patient. But I think the true technology should free up clinicians' time, and they should be able to spend more time empathizing with the patient situation. But maybe the whole construct in next 20 years will change. I can see there are a lot of great experts joining. Dr. Sunita Chauhan from Australia just was writing in the chat, and I totally agree with her that 20 years is too difficult to predict. But we try today, maybe not very radical, but something that is possible. And I invite everyone who is listening, attending, please share your points in the chat so that we can be wiser with your comments. And when we have the panel discussion, maybe we can invite some of you also to say some of your points. And without further ado, let's start the program for today. So we'd like to start with Dr. Neha Lal. She's joining us from Gujarat, Ahmedabad. She's Senior General Manager for GCS Medical College. So warm welcome to you, Dr. Neha. And please share your remarks on this future of healthcare from probably from a hospital perspective. So over to you. Please take your 15 minutes. Thank you.
Very good afternoon, very good evening to all the listeners, and my special regards to Mr. Sachin for having me here on this platform on talking about this very interesting yet I would say very complex subject of healthcare at 20 years. We are still not covered from the COVID. I think we are still waiting as in India scenario. We are waiting for third wave to come, and then I don't know what the future would bring into. Some people say that it is going to be last until 2025, and still we have to take care of this deadly virus, and a lot of new variants are going to come. So, but my experience of last 2-3 years in COVID and before COVID. I will just share with you guys here. First of all, the COVID, I mean, if I talk about the using the smartphone, because it is all about the technology, and when we say the technology driven healthcare. So I think before a decade, so when I was asked this particular topic, I did little bit of exercise, because when we are going into past and when we see that what we have achieved, I think the smartphone was there for about 15 years ago. And then in last decade, the people have started using the smartphone. The use of smartphone is something very great and amazing, wherein we do everything through this particular media. Be it, this is not a simple cellular call, and we have a lot of applications are there, which we are using for our day-to-day requirements. Similarly, on those lines, I'm also predicting that healthcare is also going to be like that. I'll just present few data in front of you. Then in year 2019, the telemedicine market and the funded in telemedicine was about $1.5 billion, followed by the analytics and data, that is $1.3 billion. M-Health applications, what we are using right now, that is $1 billion. Healthcare services, that is $487 million. Mobile wireless, $437 million, and clinical decision support, that is $425 million. Now, these are just the figures which I'm talking on 2019. If we compare these figures in one decade, maybe in year 2031, I think these figures will go skyrocket high, because all these things are, actually we are using at the 10-20% pace, and then we are looking forward to use all technology based healthcare. Giving you an example, wherein we just go for any shopping mall, or we step into any cafe or cafeteria. I have noticed that in the COVID time, there were QR code menus, and then we just have to scan the QR code, and the menu was right there in front of your phone, just to avoid the touch and handshake and following COVID healthcare guidelines. On the similar part, I'm looking forward that hospitals and healthcare, I mean, if we talk about the healthcare, all your pharmacy, diagnostic services, hospital, all these services are there. Still, healthcare is lagging behind in terms of service standards. We are compared with the hospitality, but then yet our front office staff have to be taught that how to smile at the patient, because by smiling at the patient, only half of your pain and sickness gone, and that is on the mental health and counseling part of it. But that is now, because we have failed. I mean, healthcare as an industry yet to take a shape. But then, there are systems available. If I'm talking about all these healthcare app, I was amazed to see one solution which is available in the market. What that says that whenever the patient comes in the hospital, patient just have to scan their face, and by scanning the face only, one come to know that how much happy, sad, or whatever pain he or she is carrying. And then with the help of artificial intelligence, hospital management come to know, okay, these are the patients coming up with the sickness of this percentage. And then accordingly, if there are patients vulnerability, if patients are more severe, then you can align those patients in a particular I would say in a particular line or in a particular fashion, wherein they are given importance, they are given the priority. Similarly, those solutions are available for your employees. So while going into your organization, how much happy you are, and while going out, what are your satisfaction and how your facial reactions. So due to the help of artificial intelligence, I think so many this is one of the example. But looking at the Indian scenario, recently the Prime Minister have, implemented on the fourth year anniversary of PMJY, that is PMJY Digital Healthcare Mission. Now, I look forward that mission is going to be boom in India, wherein your healthcare professional registry, your health ID, your healthcare organization registry, everything is going to be aligned. Everything will be, I would say, the registered. So it is coming from the India in as a part of, I would say, sustainable development goal and universal health coverage, wherein PM himself looking forward to cover every population of India, wherein every citizen has a PMJY card of different category, and they are given a cashless treatment in any XYZ hospital. Now that movement, if you see the PMJY, because I work in a medical college hospital, we have that PMJY test, and then we cater to PMJY beneficiaries. That whole department, that whole process is made in such a way that everything is paperless. So I think the driver is PM himself, wherein such a technology, to have the EMR, to have the CDSS, to have the CPOE, your HMIS scanning, everything is going through in as far as PMJY patients are concerned. So it's the other way around. We want to cater our private patient, cater our paid patient, corporate patient in a fantastic manner. But here, the situation is actually reverse. PMJY beneficiaries are given a priority treatment. The green corridors are being made in the hospital, and everything is technology driven. So my message is very loud and clear. In Indian settings, a lot of main reforms are being placed as far as technology is concerned. The use of artificial intelligence, there are chatbots available equipped with the deep learning, algorithms are there. There is going to be a, Nemo medicines are going to be there. That is in infant stage in 2019, but that will have eventually overperform all the branches of medical science, wherein you will have the designer drugs. The designer drugs will be more powerful than the ordinary drugs what we are using. So these are many new, agenda is there at the desk of PM, and I'm sure that government is actually, looking into such an agenda in a very rapid format, and all the healthcare organizations are compelled to follow. So if you see the digital payment, recent change in PMJY is every beneficiary will be paid, even their travel allowance with the bank. So even that is also not cash. So 300 rupees is to be given in that particular bank. So digital payment system is also introduced by government. So there are a lot of such changes are happening. Coming again to the hospital, when we are talking about the technology being used by the doctors, healthcare professionals, as we know, our doctors have a different mindset altogether. And I, coming from the medical college background, I always see that this is a challenge where, the senior doctors, senior faculties have an issue to use the EMR, to issue to, pen down or maybe to enter the data in particular file and particular patient's details. Maybe if we can address this, but my message is that if we can address this issue while in the education, if that particular module, if incorporated in UG and PG sections to use the healthcare technology, I think the nation will have lot of advantage. If you see the generation Z, which is there right now in our medical colleges or our paramedical students or nursing, like NABH started in year 2006, and now all the medical college have one module on NABH. So they are being taught by medical vice management, infection control practices, the safety codes, code blue, CPR. There are so many other modules which are there in the curriculum. Likewise, if our doctors are properly trained and imbibed in the education system itself to use the healthcare technology, then all these agenda of Prime Minister, all the agenda of healthcare as a requirement can be considered. That is something which we have to think on, where in our education system address all these new forms. Besides that, if we talk about our hospital, apart from the education incorporating, all these modules, we have made a nodal officers group who are actually, there are like-minded people who appreciate technology more. So we want that one champion, could encourage other doctors to use this EMR. Of course, the decision-making and everything is coming after discussing with them, involving them in the decision-making, taking their views and make a system. So again, the technology to use is on our hand. We have to take people along while using the technology. So as I said, a lot of solutions are available, a lot of apps available, a lot of platforms are available where we can address like this. We are discussing healthcare technology. I'm really very sure that this will take a longer future. This will actually create an ecosystem where each and everybody in the hospital, each and everybody in the healthcare systems are aligned and make up a mind to use the technology, because the advantages are numerous, and that is what we are looking into next 2 decades now. So these are my thoughts on technology and my own experiences. With that, I would like to thank you each and everyone. I would be really happy to take any questions of yours if you have. Thank you.
Thank you, Dr. Neha. So we'll have some questions in the panel later. So let's hear from other experts. And, as all of you heard from Dr. Neha, that's primarily from a healthcare delivery model, which is, through hospitals. And now let's hear from Dr. Arjun Dang. And some of you probably who are from Delhi would know the Dang lab. And Dr. Arjun has been at the forefront of some of the work during the COVID vaccine clinical trials as well. So we had him last year. So let's hear from Dr. Arjun, and he's also our active club member. So I'm very excited to learn from Dr. Arjun what he sees as possibility of future of diagnostics.
A very, very good afternoon to everyone who's tuned in today for this session. And a big thank you to InnoHealth and the organizers as well, who've given me the opportunity to speak on this prestigious platform today. So the topic of today's short discussion or short talk is technology in diagnostics and the way forward and the way the healthcare diagnostics is going to be transformed with the coming in of so many new tools and techniques, and especially the entire medtech, what we call as medtech and now we call as IOMT also, with the Internet of Things and the major changes and the metamorphosis that is going to be seen in the diagnostics industry. So actually, we've always talked about technology and using it in diagnostics and how to actually enhance diagnostics, not only from a clinical point of view, but also from a convenience point of view of the patient or the consumer. But I think it was all talk and no walk until actually COVID happened to all of us. And I would actually humbly confess that I think the past 1 year, especially the second surge, was nothing short of absolute chaos in the healthcare industry. And I'm so glad that we probably we've left the pandemic behind. But I think during COVID also, and the kind of surge we saw, I think the only thing that actually pulled us through, even from a lab's perspective, was the processes that we had in place and the automation and the tech that we had already implemented. Why I say that and why I actually look at this silver lining in the dark cloud and unfortunate cloud of COVID is because in COVID, we actually realized that with double and triple the volumes and so many COVID samples, and of course, a lot of manpower also being lesser in our team, that using things from a digital perspective and having your processes online and having all the automation and tech that you could use actually helped us get through that very, very difficult time. Now, obviously, when you look at diagnostics and when you look at the tech involved, I would broadly divide it into three segments. Most important segment that probably all of us know about is the analytical segment. That is the part of the analysis. That's when the sample reaches the lab. And then there is a segment before that, that is the pre-analytical step, and then post-analytical, that is the step after analysis. So pre-analytical basically would mean when the patient gets a thought of getting a test done, or maybe sees the doctor, gets advice, has a medical issue, then after that he makes a booking, maybe through a call center, maybe online, or maybe visits a lab. And this entire process of deciding the test and then going for the test and then finally getting your sample collected. That is the sample collection, the barcoding, the accessioning that's involved, the sample transport, etc. All of this comes under the pre-analytical segment. Then we have the analysis in the lab, obviously that we already know a lot about, and I'll further elaborate on it. And then you have the post-analytical segment that is very often missed out or not given enough importance. But I feel that once the sample is run in the machine, how that information of the report is traveling to the patient, how patient queries are being handled, how are the patients reaching out to you in case they have some kind of a doubt, or maybe it's a sample add-on, or maybe it's something related to your results and they want to compare it with some other lab's report. So how do you actually solve all those queries? How do you upload your reports on the web if you are giving it through a WhatsApp or you're sending it on emails? So that entire bit again is post-analytical. So I'll take all these three segments one by one. So let's start with the pre-analytical phase of things. And obviously this is possible in two ways. Either someone has an illness and then they visit a doctor. So when they go to a doctor, obviously the doctor takes time to examine them, see them. Now with so much of teleconsults, also that we've seen again grow throughout COVID, is that a lot of doctors are doing teleconsults, so they ask the history of the patient, and they actually address the issue and then give them medication and probably advise them some tests as well. So again, technology is playing a very big role post COVID. Like you will see, like even the teleconsults for that matter of fact have actually increased by leaps and bounds over the past 1 year itself. And a lot of platforms are available online as well, where doctors are available and they can consult you. So in this pre-analytical phase, again, you would also have these wellness packages that the patients are choosing. So obviously now you'll see a lot of these wellness packages, a lot of routine checkups also, that people are opting for more. And what I actually feel through COVID is that the keenness for good health and the awareness of a good quality lab report, I think, has again increased by leaps and bounds. So again, patients are choosing this wellness profile. So in this pre-analytical, only to assist the doctor. In the future, we'll also see things like there might be a chatbot that the doctor has. A lot of people, a lot of labs also use chatbots these days that can take the initial history of the patient and then also guide the patient about probably their nutrition that they need to have, and also give those key inputs through an algorithm to the doctor, so the doctor can probably reach a diagnosis faster and be like a doctor's assistant tool. And that's what I feel, that actually with the shortage of doctors also that we saw during COVID, that definitely this pre-analytical space can be further made more robust to assist the doctor in their teleconsults, where there is actually an algorithm working to assist the doctor to get better and more robust history from the patient, and then probably advise the patients also, obviously under the recommendation of the doctor. Then once you have the patient who's decided which tests to get, or you have a patient who then walks into a lab or calls for a home collection, the entire booking process, now if it's through a mobile app, if it's through your website, all this needs to obviously be given a lot of attention so as to give the maximum convenience to a patient. The entire thought process, even in our lab, is that when a patient is coming to you, it's obviously out of compulsion or it's a wellness check. So the patient is not in the best frame of mind. So we need to make things as easy and as convenient for them. And for this, your mobile app and other ways that you can reach the patient on an online platform is actually the best way forward. Again, a very important part of the pre-analytical segment would be your barcoding. Now, a lot of labs offer home services these days, but I'm not aware of many labs that actually do real-time barcode printing. So when you actually look at the level of automation that is available in labs, the majority of errors in any lab might be occurring in the pre-analytical space only. And this is only when the labeling is done incorrectly. So obviously, extra attention to labeling should be given, and also keeping in mind that if at the person's home, now that a lot of blood collection happens at home itself and people are apprehensive to go out, there should be a very robust process in which there is a provision of real-time printing of barcodes at the time of sample collection, so that there is no mismatch and there is no mishap once the sample reaches the lab. Again, in the process of transit, again, monitoring this sample. So a sample is not just a sample, it's actually a person. And that's actually the ethos that all of us in our lab live by, is that even if it's a simple vacutainer that's traveling in a bag, it is actually a live person in front of you. And the person's report is extremely crucial to decide on their management. So how do you actually monitor the transport of these samples, the cold chain maintenance, the exact integrity of the sample? Is it being checked when it comes to the lab? So I think this entire transit process is something that is extremely critical for tech and other platforms to actually address, and so that we can get the samples in the best state and integrity to the lab. Now, coming to the analytical segment again, I think lab medicine is the backbone of timely and effective healthcare organizations and timely management that they provide. So I feel that with the advent of now so many robots, so much automation inside the lab, where you have these sample belts and you have these completely automated machines wherein results, their precision, their accuracy, their sensitivity, specificity, if the correct SOP is followed, it's very hard to actually go wrong if you have the correct manpower and the correct machine that you are using. I think that the vendors that we see that provide us these machines as well are working at such a high level that I really feel that we are actually at a very good space when it comes to diagnostics in the analytical segment, especially when you look at clinical chemistry, you look at hematology and clinical pathology and so on and so forth. And I've also seen personally, being a histopathologist, that there is a lot of advancements in digital histopathology as well. And you have whole slide scanners, and you have remote reporting uh, processes available for simple slides, and obviously complex biopsies that even histopathologists sitting in very remote areas can report. I think it's wonderful the way histopathology and cytology as well has actually taken the path of from simple to complex cases, how to report these. And obviously the advent of artificial intelligence again in histopathology is something that's very, very interesting. Yeah, I'm actually very happy to tell you that it was only a few days back where an algorithm for screening prostate cancers on prostate biopsies got approval from the FDA. And I was reading about it, and it's certainly a very, very interesting step that has been taken by the regulatory authorities, and probably will be very motivational for other scientists and researchers also who are working in the field of AI and histopathology. And apart from that, again, now we are seeing hemat analyzers that can actually screen for various anemias, pick up blasts and other flags very, very accurately in your complete blood count as well. And I think all in all, artificial intelligence, other tools, other robots in the lab are always going to be a very key part of the functioning of the lab, that is to assist the pathologist. Obviously, I never really feel, and obviously keeping my fingers crossed, that they'll ever replace doctors and pathologists. But I think moving on in the next 10 to 20 to 30 years, things are really going to shift towards these tools. And especially now we are seeing so many wearables like the Apple Watch as well, and your Fitbit as well, that on a real-time basis monitor your vitals, monitor essential parameters that you need to measure. Now you also have these glucose monitors. Actually reading the other day about a smart toilet. So this is a device or a chip that's put inside your toilet, and every time when you go in the morning and pass urine, it automatically gets all your parameters in the urine, and obviously will highlight in case there is any aberration in it, so you can go see the doctor. Again, with the Apple Watch also, it's very interesting how I'll tell you a story about a basketball player who had an irregular heartbeat. Obviously, the Apple Watch picked up the arrhythmia and then warned him to go see a doctor. The cardiologist actually later saw him, and he was diagnosed with cardiomyopathy. And in this entire process of his hypertrophic cardiomyopathy being diagnosed, it was also discovered that two of his siblings were suffering from the same disorder. So again, simple things like wearables and how these couple of examples that I've told you have taken the lead. I think in the years to come, it will become more and more towards advancing technology. And even using these kind of wearables is going to be something that won't be out of the ordinary. Again, looking at a country like India and how to actually adapt in the analytical segment, I would certainly say that a lot of attention needs to go to POCT as well, and to have point of care testing, especially in tier 2, tier 3 and rural areas where it is not possible to quickly build such infrastructure to provide such testing services. And that's why I would really request the regulatory authorities also to give more focus on point of care testing. I know that in certain point of care testing devices, obviously accuracy will be a challenge, but to actually look at this from a bird's eye point of view, where a majority of the country is in rural areas, I would say developing point of care testing is indeed the need of the hour if we need to go towards a healthier nation altogether. Again, in the analytical segment, I think if you actually ask me, I would feel that within 20 to 30 years, probably there might not be a single lab that is left, or at least within 40 to 50 years. Again, I hope that doesn't happen. But the way that things are progressing, it's actually very interesting that it might just be a small chip that is implanted inside you, and that on a real-time monitors all your kidney parameters, your liver parameters, and whatever blood test you would require. You don't really need to go to a lab or give a venous sample. So that is something that's very interesting, and I would myself want to see how that evolves. And so again, coming to the post-analytical segment, again, it's very, very interesting how it was only till a few years back that there was absolutely no concept. So in the post analytical segment, it was only till a few years back that a lot of labs weren't even giving online reports. But now there are very sophisticated patient portals, and reports are given in every form possible. And I think that is further, that convenience factor for the patient is further going to grow in the next few years. And also understanding reports. Now we have these amazing smart reports wherein the anxious patient can certainly understand a lot about their test without actually having to Google them, and actually not going to the doctor, as in before going to the doctor. So interpretation of reports, delivery of reports, again troubleshooting, query resolving, etc., all these are going to happen through AI chatbots in the next few years. So I certainly feel that technology is something that's going to make us grow stronger and move forward even faster. But certainly with healthcare, we should never forget that adapting technology is actually like changing the tire of a moving vehicle. So it requires a lot of clarity, a lot of commitment, and definitely, most importantly, a lot of teamwork. Thank you. Thank you so much.
So that was Dr. Arjun Dang, and I think all of you would agree with me that diagnostics is a topic which has seen the most traction in the last 2 years that we have seen COVID in terms of the path-breaking technologies. Also, the last year was the year when there was a Nobel Prize given for CRISPR, which is another very interesting technology. And the Moderna's vaccine was built on mRNA technology. And I think we had this one panel discussion with where Dr. Arjun Dang was also part of, where I was telling at the Helsinki airport, they were using sniffer dogs to smell, whether a person who is going through the airport has COVID or not. And he was, of course, laughing at it. But I think we can learn a lot from nature, how we diagnose things. And I think Reliance ended up buying a company from Israel, which was able to do COVID testing based on the volatile compounds that we emit in our breath. So I think there's a variety of ways by which we are bringing down the time that it takes to diagnose all kind of issues in human body. As Dr. Arjun himself mentioned, that point of care testing, I think, is the main keyword here, and also the rapid diagnostic, how fast we can do it. And probably we may see in future pandemics again, and diagnostics will play a very important role in how we control these pandemics, whether it's through contact tracing or effective diagnosis at the site itself. But the next speaker I have is not doctor, but Rohit Ghosh, who is also our active club member. And Qure.ai is actually making waves, with their AI solution, not just in India, but all over the world. So I think we are very, very proud of having Rohit as part of this conversation, sharing his thoughts on AI. And I have been part of 2 courses that we ran last year, AI for clinicians, and Rohit has also been a faculty in those courses that we did with PHFI. So I have been very, very confident with this work that is happening with AI. And let's hear from Rohit what he has to offer for AI making healthcare accessible and equitable.
Hi everyone, good evening. This is Rohit here. I'm one of the founding members of Qure.ai. And today's session is primarily about, I was asked to talk about what does healthcare look like in 20 years, and what sort of role innovation and technology plays in that. And I thought artificial intelligence is obviously something that is something I've been working on since last 5 years, and thought it might be a very interesting perspective to show what is actually happening in different parts of the world as of today, to give you an aspect of what could possibly be there in the next 20 years. That would sort of give you just a glimpse of what could be potentially possible at a much larger scale. So I have a couple of slides. I'll walk you through some of that. But the idea, again, as I said, is primarily just to sort of give you an overall idea of some of the stories that I have. So this is not a slide as much about Qure and what we have been doing, but more about some of the very interesting stories of how healthcare is already getting changed in different parts of the world, and even in the most unlikely of places that is happening. And then that would sort of be able to give you a much better idea of possibly what it looks like in 20 years. So that's the agenda. I'll just sort of give you a brief overview of Qure so that you understand what we have been working on, what innovations we have been trying to bring into the space. And then we'll jump into some of those interesting stories. That's the most interesting part for me. So about us, I think we started almost 5 years back, primarily building AIs for medical imaging solutions like X-rays, CT scans, ultrasounds. All the solutions are FDA approved. They're focusing on 9 different disease areas. Today, we are deployed almost across 46 different countries and processing somewhere close to around 200 million images globally. So definitely a lot of experience in deploying and bringing some of these innovations into real life practice, into real life healthcare across the globe. And in terms of the work that we specifically do, I think there are 3 major AI solutions that we have been bringing to the space. One is an AI, the other is AI for chest CTs, the other is for AI for chest X-rays. So all these solutions can look at a CT or a head CT or a chest CT or a chest X-ray, can identify all the major findings from those imaging modalities completely automatically within almost 20 seconds or so. And at a fairly much higher degree of accuracy as compared to human readers. I'll come to some of those interesting bits slowly. And this is the footprint, I think, as I mentioned, almost 45 plus countries, almost close to 500 sites, I think, as we speak right now. Almost close to 10,000 plus lives that we touch on a daily basis. So that's just about Qure. Quickly jumping onto some of the very interesting stories. This is my most favorite part of the story. So this would give you a glimpse of, rather than me telling you what could possibly healthcare look like and leaving it up to your imagination, I thought maybe just can help you imagine better given some of the very interesting stories that are happening, right? So the proof of the pudding lies in the eating, right? So let's jump onto the stories. So this is a story of 10 radiology groups in Southeast Asia. We're using the chest X-ray solution for primarily separating all the normal chest X-rays from abnormal chest X-rays. Almost 40% of the chest X-rays that are processed by the AI are completely termed as normal chest X-rays, and those did not even looked at by human readers. Now, you might ask, why is that such a phenomenal change? Is that even an impactful thing, right? Chest X-rays almost take around 80% of the chest X-rays are completely normal chest X-rays in any setting almost, right? And in that kind of a setting, where chest X-rays is the most commonly used imaging methodology across the globe, you take X-rays left, right, and center for everything and anything across the sun. So in that kind of a scenario where you have so many X-rays lying around and no one wants to read them, most of these X-rays lie completely unreported in most of the hospitals for a very long period of time. Whereas X-rays is the most primary and the first method of screening in any disease or diagnosis zone, right? So in that kind of a setting, if you're having these X-rays unread for so long a time, there's definitely so much of room for improvement where AI is able to now bring it to the place. And imagine if we're able to read all these X-rays and able to identify a screen for those early signs of tuberculosis, lung cancer, COVID-19, heart failure, all this on the chest X-ray, and we are able to catch hold of the patient while the patient is at the hospital. That is real change. That is where healthcare is going to be. It is already going towards, and this is, as I said, this is just one of the starting areas where all these abnormal X-rays, which are found as abnormal by the AI, are read by the radiologists then and there. Now, this is an interesting story from Kota in Baran in Rajasthan, where all you see in the picture is people who are lying up in a primary healthcare facility in Baran near Kota, where all these people are lying up for tuberculosis screening. So TB is obviously a big disease in India. And for TB, the major challenge is all these are daily wage earners. So if they come to a screening center like this and they have to again come 2 days later for a sputum collection, that means they're losing wage, right? That's a daily earning for them. And then that's why you don't have normally these patients turn up after 2-3 days for sputum collection at most of these healthcare facilities. Now, when we deployed AI, the magic was that now you can actually see within 20 seconds whether the patient is TB presumptive or not, right? And if it's TB presumptive, you catch hold of the patient, do a sputum collection then and there, and then within an hour or so, you can actually get to a TB diagnosis, right? Within a day, you do that. You don't need to ask the patient to come back. The patient is not losing their daily earning, and that's why you have a lot more patient follow-ups. So very interesting that normally you expect AI to sort of be the most impact with some of the developed countries, as you would call them, right? Some places where healthcare infrastructure is really well integrated. You think AI would possibly be the most effective there. But contrary to that popular opinion, having deployed AI in almost 46 countries, we know that AI is actually playing a much bigger and much impactful role in some of the other different areas where we possibly don't even impact it. So we found that not only is AI able to reduce turnaround times, but it's also detecting more number of TB cases, right? Because a lot of these AI algorithms are actually way more accurate than human readers. Human readers normally in some of these areas, remote areas, miss out on a lot of these TB cases. We have been able to detect 33% more TB cases just in this particular deployment. When COVID happened, that was a very interesting story. So we were already working with the Municipal Corporation of Mumbai, the BMC. And with them, we had been working on tuberculosis eradication in Mumbai. And COVID happened, that presented a very unique chance where we could actually deploy the AI in this mobile vans that could go out into the remote vulnerable areas in Mumbai, like Dharavi or Worli for that matter. Where you see they have been following this protocol, right? Where they did a mass screening of individuals where if their vitals are found to be abnormal and their chest X-ray is always also found to be abnormal, then they were sent for an institutional quarantine. Whereas if the chest X-ray showed slightly lower symptoms and their vitals also look, but the vitals look slightly challenging, then they were sent for home isolation. And if everything was fine, then they obviously have a normal. And this is something we did started off in the peak of COVID last year. And has been extremely successful. The fact that we have screened almost 30,000 individuals till date, right? That is a testament to the kind of scale at which healthcare is impacted, using AI. Because the challenge here in all these places in Mumbai and India also was that there was not a lot of RT-PCR cases, a lot of RT-PCR tests available. So in that kind of a setup, we could use AI to actually see which patients can be tested right now versus who can be tested 4 days later. So AI played a huge role in managing and monitoring patients during not only the normal healthcare challenges that we have like TB, but also during the most biggest devastating healthcare challenge we faced in the recent times. During COVID also, AI could suddenly, being an innovation, it could actually adapt itself to the COVID settings and actually proved out to be very helpful even for a government entity like Bombay Municipal Corporation. But then this is not just India, as I was mentioning. This COVID-19, we had a very big use case with the NHS trusts in UK. This was in Bolton, which is one of the higher COVID-infected regions in UK, where the AI could actually do the similar task and actually help the clinicians there in monitoring the progression of admitted patients in the ICU, whether their lung condition is improving or deteriorating over a period of time. And we got a lot of awards just in UK for that fantastic deployment that we did with the NHS Bolton for COVID-19. Outside COVID-19, coming to other aspects of healthcare, the other aspect of healthcare is emergency care, right? Where you sort of need a patient, have a patient coming to an emergency ward, and then he needs an urgent care, right? And the challenge here has been always that most of the times, in most of the settings, there is not enough resources at the in the critical hours, right? So specifically after, in the night, in the midnight, some of those times in any part of the world, right? Not just India, UK or some, but every part of the world you face that challenge. And in a slightly remote setting hospital. So that's why teleradiology solves that problem to a very good extent. But even within the teleradiology organizations, the challenge is they receive a lot of scans, right? And I'm talking about, this is UK's largest teleradiology company. It's called Medica. So they have been using, they face almost, I think, close to 5,000, 6,000 scans, critical scans on a daily basis. If that kind of a volume, you do not know which is actually way more critical than something that can be possibly looked at slightly, with a 1 hour or 2 hour delay. Because if it's a stroke patient who's coming in, right, they need to be acted within 20 to 30 minutes. You need to have a report out. In that kind of a setting, AI is playing a huge role in sort of identifying which patients can be reported right now. So they pick those cases and put up at the top of the work list. It also generates a very good initial report, which is just then signed off by the human reader and sent out, right? So this is something which is helpful in some of these critical places like stroke, right? Where every minute counts, every minute is a life saved. And using AI to save lives there's nothing that gets better than that, right? So it's just not only a regular identifying more diseases, but just in case of critical care, right? And this is not just in teleradiology. We are seeing this in multiple remote sites in India, in ambulances, everywhere there is something where, there's a critical role that needs to be played. AI is coming in handy. It's able to identify when patients, while the patient is in the ambulance, it's able to identify whether that patient needs a stroke care right then and there. So hospitals, teleradiology, ambulances, there's a lot of application which AI is able to bring. Now, outside that, this is an interesting story of immigration screening, where for immigration, a lot of chest x-rays get done. And this is with the Ministry of Health in UAE, where they have been using the x-rays. They're almost looking at close to 4,000 x-rays on a daily basis, and with a very limited bandwidth. So in that kind of a setting, AI is super helpful in, again, picking out those normal chest x-rays so that you can just very quickly get those, immigrants screened and their medical fitness report issued very quickly, whereas the rest of the cases can sort of take their time, right? The cases that are abnormal. And this is the same case that is not just in, I think I've told you, in India, in UAE, but also in South Africa, where this is being done in this mobile vans. The mobile vans is a very interesting concept, where now you're not only doing what earlier healthcare used to be something where you used to go to a hospital and then you had all of this done at a hospital. But what we are seeing more and more in every part of the world, that healthcare is coming to your home, right? It's not anymore something you need to go out and do. But with this mobile vans, and this is not in South Africa, we're seeing this in every part of the world, that these vans go out in the community, they screen people. In South Africa, it's primarily TB. In UK, it's primarily around lung cancer. But a lot of these places where the vans are going out into Walmarts or this supermarkets areas, and then they primarily screen people for different diseases in the van. So you can just get onto the van. And again, the benefit is if you have an AI in there, if you figure out something's wrong with the patient, you can take an action on the patient right then and there. So that's the kind of impact which AI brings. And with some of these things being done on a mobile van, you can now go into a very remote area, let's say in Rajasthan, desert area. And you can actually do this at a scale, right? Which is something which has been missing in healthcare. While we talk about improvements at 20 years in healthcare, a lot of ideas tend to be around what more can you do with MRIs and what more advancements coming. A lot less is being talked about what you can do to actually improve healthcare for people who don't have access, don't have access to healthcare and to quality healthcare at a low price. This AI, and with some of this innovations like putting them into mobile van, mobile x-rays, taking it to remote locations, that's what is real impact, because that's when you're creating a lot of impact with very less means, right? So that's what in India we call as Jugaad. And that's a proven innovation that is driving healthcare as of today. And not just in South Africa, this is sort of happening in Philippines as well, similar projects with multiple mobile vans, almost 30,000 plus people screened in Philippines for tuberculosis and for lung cancer as well. So it's just not about, infectious diseases, but lung cancer is obviously a big, big killer in lung cancer space. And you're doing so many x-rays every day. What is the chance that there is actually an incidental stage 1, stage 2 lung cancer patient out there, which we are missing out? And research did show, when we compared our AI against human readers, the AI detects lung cancer, incidental pulmonary nodules with 17% higher sensitivity. So there are those patients, stage 1, stage 2 patients, who are getting missed out on a regular basis. Those are the kind of patients and those are the kind of impact that we are able to drive for lung cancer screening as well in multiple parts of the world. And just the last bit, so this is what we are doing in Latin America, but not only in Latin America, but in other parts of the world, is bringing innovation on analog X-rays, because what we see is that not digital X-rays are very rare commodity in most parts of the world. So innovations needs to happen where actually there's a need for innovation, and that's why we have been able to provide this tool that you see here on the side, which can actually look at an analog X-ray where you can take a photo and you can get a results within 20 seconds. So this is currently live in almost 17 plus Latin American countries where their physicians are using this app to detect all different findings from the X-ray just using this mobile app. And similar project in India as well, in very remote part in Samastipur district of Bihar, where this is being done for tuberculosis, where they're using the mobile app for screening analog X-rays. Almost 22% TB cases were picked up, which were missed by radiologists. So that's it. That's just a brief overview of what we have been doing so far and how possibly healthcare would look like in the next 20 years. With some of these things actually taking more common practice, I think healthcare is bound for a big, big improvement and a more equitable and more accessible change in the next 20 years. Thanks a lot.
Well, that was Rohit Ghosh for all of you, and I hope you also find it very interesting. I always find it very inspiring, and I am right now in Oslo in Norway, and I can see that here in Nordics, the healthcare data exists for last 50 years in the digital format, and a lot of the current AI research is about building algorithms like on dementia and detecting colon cancer and other topics. So I can see that AI is coming in a big way, at least here in Nordics, when it comes to healthcare. So next we go to Mr. Sanjay Jain from Akhil Systems, and Akhil System is in one of the largest healthcare IT systems provider in India. And let's hear from Mr. Sanjay what he thinks that HIS providers believe is coming in next 20 years.
Good evening, everyone. My name is Sanjay Jain. I'm the director of Akhil Systems. We are a software company specialized in developing solutions and software for healthcare industry for the last 27 years. I'm fortunate to serve this industry for such a long period. It's almost more than 2 decades are there. 94, 95, we started this journey, and almost 2 decades, 20 years, we are serving. We have a large implementation base across India. More than 300 hospitals uses our HIS, and abroad around 15 countries across the world also uses our products. I would like to say thanks to Dr. Singh, Sachin and Sanjay for giving us the opportunity to talk about how the technology will transform healthcare in next 20 years. I should say it's a very, very difficult topic. It's a very challenging one. I should confess that, because the way technology is moving, every couple of years we are finding the way we are living, it's got changed. We never imagined 20 years back we will be having everything on our mobile, whether Google Maps are there, no one is asking, we are going from place to another place is there. The way we operate, whether from buying vegetables to groceries to the airlines bookings, everything is automated one. You got Ola and Uber, very big example of technology, who doesn't own any car, but around the world people uses that. So what did happen? It happened through technology. In my early days, in my childhood and in a young age, probably, my father was a government servant. We were living in South Delhi at that moment. And during for healthcare, for any problem, we used to go to a nearby government dispensary. And where certain doctors were there. And we used I remember Dr. Datta was the most popular one. And we go there, and then he prescribed medications on a piece of paper. We carry the complete full papers file, all the lab reports, previous prescription. My father, unfortunately, was asthmatic patient, chronic asthmatic patient. So he used to carry that file. And once if the medicines are not available, we have to go to the subsidizing hospitals, and there we have to collect it. Even the government facilities, okay, or I should say the treatment was very good, but the services were not there. because of the reasons, because there is no other alternate was there. And thanks to Dr. Pratap Reddy in 1983, he's a visionary. He started first corporate hospital in India by name of Apollo. Everyone knows about it. And then the history. All the new players have come. People have realized in private healthcare also it can be changed. So this 20 years, a change in transformation has taken place. And then, in our part, we were having DOS-based system, then we moved to Windows, then we have come to web, and today is a cloud technology. So it's almost 27 years or 25 years, around 5 or 6 times we have rewritten the product. New technology has come, and that's for us to come to the new era. So if you look at from that part, this is a slide which talks about the earlier stage. And then there's a beautiful hospital setups, almost 5-star hospital setups have come across India. A lot of medical tourism take place, and we have got best of doctors, best of services, best of specialties. So all those have come. But unfortunately, I should confess that for the patient part or the integrated ecosystem, nothing happened. Still, we have to go to a hospital, and if we being referred or we feel we need to visit to another hospital, we don't have any other thing. So what happens? We have to carry those papers again. There is no interoperability. There is no data exchanges there. There is no connectivities there, and everything remains same in the old fashion. We have not moved, earlier way, the way we have seen telecom on fintech wave has come. Now I feel after this COVID era, health tech wave have come. So health tech is going to be the new technology wave, or tsunami, I should say, going to be there, because we are already very, very late. So the system will change from an organization-centric perspective to patient-centric perspective. Patient going to be drive the complete healthcare ecosystem. The patient is going to have everything available around that. So if you look at from that perspective, this is one of the things which I would like to highlight. You being a patient, you have a provisions in the technology world to choose online, any hospital, any doctor can book an appointment online, can pay it. No need to stand in the OPDs. Might be OPD will more or less going to be limited to very, very specific area in the hospital. Majority will take place, telehealth will take place, and you will consult a doctor. He will prescribe you the medications or investigation. Then again, you will have a choice. Either you want to go to that hospital for investigation, otherwise you go to nearby lab or any other hospital. Your request will go automatically, and someone will get that particular request for medications, and then immediately the information will come to you. The medicine will be delivered to you. Similarly, for your investigations part, sample will be collected. So you will be not confined to the 4 boundaries of a hospital part. You will be, the whole ecosystem will opened up. So I will have a choice as a patient to choose anything, get my facility availed anywhere, buy my medications are there, avail my home care services at my will, at my home or other places. So all those things will come. So you will be having virtual hospitals, virtual clinics, and maybe the kiosk kind of setups will be there. The specialist sits it and you can connect with them. So this is going to happen. Already the COVID has realized us we need to do all those parts. So one portion, all this will be interconnected. And once you have got this data available to you, then the tracking, daily tracking of your vitals or the messages or the care part will be tracked on that basis. So I'll just give you an example of how the technology is going to unfold. We are working on a project at this moment. And the biggest challenge we have seen in the industry, after you get discharged, maybe there's a bypass happen to a patient. Now he goes back. There is no provision, a very limited way. Hospital goes back to patient, ask them on regular basis how the treatment is, how he's feeling. So now we are working on a conversational AI, and through that conversational AI, we will be starting post-discharge follow-up with him on WhatsApp. A call will be difficult. Sometimes people are not very comfortable. So WhatsApp message will pop up in the morning. How, Mr. Jain, you're feeling it? For example, I take my case. And then you reply, I'm okay, but I'm having fever. So that the system will talk about how much is the fever, and then they say, okay, it's so much, okay, wait for one more day, we'll get back to you. Then the next day and the next day, like that, 15 days, maybe the follow-up is required, or in between something happens or critical, which is abnormal, immediately alert will go to the nurse or to the doctor is there. My friend lost his elder brother because there is no proper follow-up. He was a cancer patient, and post chemo, the BP went down, and he collapsed. So that has realization has given us if we should do something on that post discharge treatment or follow-up. Similarly, there will be pop-ups will be there, or chatbot will be there, which is going to, before you take admission, system will guide you. Okay, do you have the insurance? You say yes. Say upload your insurance documents. The document will be sent to the insurance companies. They will validate to you, and then by the time you reach is next day the hospital, everything is ready. The problem which happens, couple of hours it takes before you get admitted, because all these paperwork, all this communication, and there is no connectivities. There are always, it kills the time and have the inconvenience to the people. So these are the few examples I have given to you. And then the home care going to be, or virtual care going to be play the major role. A lot of things will shift to the home care. You have got already started dialysis, chemo, small centers are there, which is taking place, and so on. Then the entire payment part, maybe the cashless transaction will be there. Everything will be interconnected, like the way Paytm happens. Healthcare also will be revolutionized. Already is happening it, but more you will see your all these cards will be automatically linked, and its payments will be done. And then your ambulance or transportation facility will be there. So this whole new ecosystem will take place. I'll just give you one more example. I was talking to one of my friends in London, and he was telling to me his complete medical records are available to the grocery shop or malls. And when he go to that mall, if he's a diabetic and he chooses to buy certain things which is being recommended as by the dietitian, so he will get discount on that. So there is a provision that they can know Mr. X is diabetic or is a heart patient. These things doesn't suit to him, and if he buys that, they should be promoted as a discount. Similarly, the medical record will be available to transport authority, and other authorities are there. So all this ecosystem, not only in healthcare, will get merged or accumulated together as one piece. So my information will be known to anyone who is interested if the required access is given. I just give another example is there. He was traveling from airport and going to his home, and slightly he stopped in between the car. So the cop came immediately and asked it, okay, Mr. Do you have any problem? Are you okay? I came to know you have a problem, heart problem, and while traveling you stopped one place. Is it everything is okay or fine? So what it happened? It happened because the medical records are available to the cop also with the car registration number. I'm just giving a few examples what's happening it. India has to catch up. We need to catch up. We as a technology company has to catch up and bring all these things together as a one piece and serve the to the patient's part. So how is going to happen? Is going to happen. We're going to do the three things as a technology part. One is the collecting of the data capturing should be there, and then the storage will be there, data cleaning will be there, that portion will be taken care. Second thing will come to make this data more intelligent and convert into actionable item. So the AI ML will take place, like the example I've given to you, post care. So my data will be more meaningful, it will be drive out. It has already taken the place on the data. If anyone is unwell, or maybe it's medical condition, you can predict him. He may be having heart problem in next 10 years or 20 years. Those things will be very, very going to take place by AI ML. And another interesting thing which I'm saying is going to be all machine oriented. एक जो हिंदी में कहते हैं machine बोलेंगी, like the way we see Alexa, Siri. We talk to Alexa and then he says, okay, switch off the AC, open my lights, and so on. So similarly, all these wearable devices will talk to you. You will be always some doctor, somebody will be there who will guide you. If you miss out your medication, it will tell you need to take medicines. If you miss out your vaccination for your child, If you miss out any other thing which is required, system will tell you all will be available. Everything will be IoT enabled, chip enabled, which will transferring, putting the data into the ecosystem, and then the people will be there who will be capturing and analyzing it. And this going to ultimately going to be engagement, which I told to you, all mobile apps, all latest IoT devices, anything which you for that sake will be available to you, and it will be health mart, health mall should be there, all online like Amazon, and we on that basis you can choose that. So the infrastructure and then the intelligence and the engagement model will going to drive the new ecosystem. Then these are few things which I'm saying it post 2014 or 2041, when I will be in my 70s, almost going to be 74, 75. And hopefully I survive and able to see what I'm talking about today. It's all, everything will be automated, digitized, everything is connected. AI ML will be there to diagnostic predictions. Then all your insurance approval system will be integrated. Voice-based EMR, HIMS will be available, and clinical decision support system will be there. Use of blockchain will be there to make the data secure. The chances of theft or making manipulation by anyone will be all eliminated. Use of virtual reality will be another real thing will be there. 3D printing will be another part where using the free technology, we can artificially create the organs, implants, or something which we would like to replicate to the patient's treatment. Then augmented reality, robotics going to play a role. I was in Netherlands a couple of years back, and I saw the innovation center, and robotics, they were using it for neurosurgeries out there. We have no robotic pharmacy in one of the hospitals in India where Akhil is implemented there. Very nicely, the robot picks up the medications out there. All IoT devices based on that. Then nanotech, nanobots, and those going to tell you about the early diagnosis or treatment or cancer part. Those things, all those will be put together, going to be the new story, new way we operate. And I wish we should able to see those part. Thanks to the Honorable Prime Minister taking up the Ayushman Bharat Digital initiative. And this is a very, very big step. This is my dream, where we should be able to connect all our centers are there. But now not only Akhil, all the hospitals will become on board on the platform. You have going to have a digital health ID or digital locker or certain provision, your medical records will be available and will be accessible to everyone. So the days will go where all traditional ways all will end. Everything will be technology driven, and technology going to drive everything possible, and we will all will get benefited by that, by different segments of the technology part is there. So there are so many things to talk about, but I personally believe the future of healthcare is very bright, and we all have to work together to make it a success. As a technology firm, as a company who is having a good amount of hospital, we should work on that part to amalgamate other technologies and serve to the health to citizen or to the patients out there. Thank you very much for giving me the opportunity. Let's wait and see and wish and pray to the God. Thank you very much.
So that was Mr. Sanjay Jain for all of you from Akhil Systems, and now we enter into the part of the session today where we have Q&A. So many of you have written your points in the chat. So if you want to speak, please raise your hand. We can give you the mic access. And I know that many of you are deep experts in these topics, so I'm sure that you have opinions. And I can already see that Dr. Sanjeev wants to speak.
I have been looking at technology innovation for last about 5 years in India, and I have seen many very practical, low-cost, scalable innovations in various parts of the country at state level in the government system and also in private sector. But what disappoints me is, some of these have been in place for 5 years, 10 years, and these have not been scaled up. There is no institution in the Ministry of Health or outside which looks at scaling up these innovations so that we can reach the last beneficiary. To give you an example, in Tripura teleophthalmology, was being provided 5 years back to every patient coming to a primary health center, and all the ophthalmologists were sitting in the capital city. It has been scaled up in one small state, but there is no effort to scale it up in the whole country to address the shortage of ophthalmologists, for example. What can we do to address this problem?
Right, sir. I think we definitely need, some agency to, like you said, to scale up innovation. I believe in your previous assignment at NHRC, didn't you have such a provision to scout for such innovations and scale them?
Yeah, there was, thanks Sachin, there was an initiative which I think is continuing now. Any innovation anywhere in the country, but focused on public sector, could be uploaded, and NHSRC would look at that innovation. If it has not been evaluated, they will do an independent evaluation. And if it meets the criteria that it addresses burden of disease, it is scalable, cost effective, then they were invited to make a presentation at a national summit, which was invariably chaired by the health minister, the union health minister himself. And then states were asked to identify which innovation they want to scale up. But even with that, there was hardly any innovation which was scaled up in the whole country. So this platform existed, but unless you have accountability at some level, you will not have some of these low cost innovations scaled up to benefit the whole population. That is what I know. I don't know if there is any other initiative by Niti Aayog or Ayushman Bharat to scale up these innovations.
Well, sir, there are a lot of things happening now, but maybe what exactly you are suggesting is probably not there. I know that now, for example, Kiran Majumdar Shaw has also started a hospital-based incubator. I can see Dr. Vijay Agarwal is here. I don't know, sir, if you want to speak, maybe Alok, we can give access to Dr. Vijay. Hi, sir, good evening. Sir, do you have any suggestions or advice on scaling up innovations, or have you seen anything? So Dr. Sanjeev, maybe I don't have any additional answer, but we can look for more questions. Thanks for your contribution, sir.
Thank you so much.
Professor Sunita, would you like to speak? Would you like to share your viewpoints? Okay, your mic is not functional. No worries. So I can see that you have written so many good points in the chat. And I think you're asking me to read out, so I'll definitely do that. So you have mentioned 3 points. So the first one was that is it true that the change drivers tech are well known for quite some time now in other parts of industry and their ensuing applications in healthcare being studied and analyzed now? Do you think the area of healthcare could itself become a mother father of new technologies in the next 20 years? What could that possibly be? So I think it's a very interesting question, Dr. Sunita. I think you are almost hinting as in US, the US defense has been a funder of a lot of innovation, and internet being one of them. Could the healthcare become in a way an incubator of new technologies? And I think the only issue right now that we see that healthcare is like built on many building blocks, like healthcare IT is one, medtech is one, diagnostics is another, then of course the clinical side. So it requires a lot of multidisciplinary expertise. I think people who can succeed in this uh, are those regions or players who can bring these experts together. So I see, for example, here in Nordics, a lot of university hospitals are able to, bring innovations and try out new things because they have access to the university setup where they have non-medical researchers as well who can bring in all kind of expertise. And I have seen this in Sweden, for example, in Uppsala, and also here in Norway, in Oslo University Hospital, they're doing very good, advanced research. But definitely, I feel that if Department of Defense can do this for, military technologies, why can't people do this in healthcare technology? But I think the challenge there is bringing the diverse experts together. Then the second question that you mentioned was, it's good to be excited with tech-driven transformation in healthcare and explore more and more medical life science faculties, specialties embracing it. Are we able to predict, analyze the challenges that tech may bring, other than training personnel involved? I think you already mentioned probably in your third point also about the over dependency on the tech, and I think Dr. Sanjeev also mentioned that when banks are now digitized, sometimes the system goes down, and then the bank is not functional. So I think maybe maybe a short answer, at least with my limited knowledge. Others can feel free to add if anyone wants to. I feel that definitely we are getting into an era where the understanding the technology is becoming more and more challenging, and we can definitely commit a lot of mistakes. And of course, technologies like fire, you can use it to burn, you can also use it to cook. So we have to be very careful, especially with these gene editing technologies which are now out there. We don't know whether somebody created the virus or it was a natural virus. The question is yet to be answered. But maybe in future there will be ethical debates about many of the technologies, whether they should be used or not used. And I think I can only say that with my limited knowledge, Professor Sanita. Dr. Sanjeev, do you wanted to say something?
Yes, can you repeat the question?
The question was around that when we have the technology, which is coming up, what are the challenges that you see apart from, training of the personnel, apart from the human resources catching up? What could be the other issues with?
All right.
Yeah.
Okay. Sachin, you will remember we had published an article in your journal where we looked at the bottlenecks in making technology available. One is technology. First bottleneck is, does the technology address the major bottlenecks in healthcare delivery? At times we have technology innovations which are not really addressing the major bottlenecks. Second is, if these bottlenecks are addressed, there are very few technologies which are evaluated by independent agencies with unbiased approach to evaluation. If they find that it works, then there is a need to pilot it on a large enough scale. In India, large enough scale is at least one district. If it works in one district, then it can be scaled up in the whole country. So there are these 4 levels at which I see the bottlenecks. And then the resources and the support, if it is going to be scaled up, that is invariably missing. The people who innovate are not really experts in how to scale it up in the whole country. You need to engage the bureaucrats, you need to engage the politicians to make funds available to scale up these innovations. This is how I summarize the bottlenecks in scaling up innovations in my review of innovations when I was working in NHSRC.
Yeah, thank you, sir. I think we are now fast approaching the conclusion of this session today. So I would like to thank all the speakers, all the participants, and experts like yourself who have shared your valuable time and contributed to building up of the session. I don't think we have done justice by really giving the answer that how healthcare will evolve in next 20 years. I believe that most of the people or the experts that have spoken, they definitely probably defend the status quo. The hospital person will definitely talk about a future where a hospital is still relevant, and a diagnostic person will talk about a future where diagnostic is still relevant. And we don't know whether the delivery format, has to be still in a brick and mortar format where you have 1,000-bed hospital. Maybe we all will go to a future which is preventive healthcare and not just curative healthcare. And I can see that a vision document about 2030 in the Nordics, which is called the Nordic Health Vision, where they talk about that 10% of the GDP that they put in the healthcare as of today, they want to put 5% of the GDP for preventive healthcare and 5% on the curative, because in the classical, text, there's something called as Malthusian trap. So the more healthy the population you have, the more disability adjusted life years the more longer the population is living. Here in the Nordics, they're spending at least 95% of their budget on the disability adjusted life years for the population. So they feel that they cannot sustain, spending 20% of the GDP on the healthcare in next 20 years. So it is only possible when they go to a preventive healthcare. And preventive healthcare, if you think about it, it only means that we have to be very good at monitoring. Monitoring means we have to be very good at diagnostics, and to be very good at diagnostics at a day-to-day level, it doesn't sound like that we have to go to labs, but we have to have the infrastructure and the sensors and the technology. That's something which is work seamlessly, like Dr. Arjun Dang mentioned about the smart toilet. So I think we have to look at healthcare in a more holistic sense. And probably 20 years from now, if we stumble upon some kind of a holy grail, then if we start living, let's say not 100 but 120, 130 years, as a lifespan, and we want to live the last 50 years of our life, not in an elderly home, but more active life, I think a lot of things have to change in the healthcare as we are having them today. So that's my small conclusion for all of you. I hope you enjoyed the session. I definitely enjoyed myself, and thanks again for joining us. Thank you, everyone.